Looking at the ductus deferens, that's going to be the connection between the epididymis and the urethra. So again, it goes up from the epididymis. So again, I have the head of the epididymis, and then tail is going to make that U-turn and then lead to the ductus deferens. Again, we used to call it the vas deferens. So if you heard it that way. Goes up the spermatic cord, goes through the inguinal canal into the pelvic cavity. Then comes, didn't leave myself enough room, so urinary bladder goes in the pelvic cavity, kind of goes up the superior side, and then comes around the posterior side. At the posterior side, it's going to, of the bladder, it's going to produce the ampulla, which is a widening of the ductus deferens. So it just gets wider at kind of the end. And it joins the seminal vesicle, so a gland that's going to add fluid to the sperm. So this is going to be sperm traveling mostly, and then we're going to add some fluid to it. So the seminal vesicles are again on the posterior side of the bladder. So the ductus deferens and the seminal gland is going to, or the seminal vesicle, is going to join kind of two forces together to form what we call the ejaculatory duct, which is going to lead into the urethra. There's smooth muscle all along the ductus deferens. Remember, we're going to have peristaltic movements. So from the digestive system, we know it's where we want to kind of, in the urinary system, wherever we want to move something, we're going to have smooth muscle with peristalsis. So we're going to have kind of contraction, and then it moves forward, and then we have contraction, and then it moves forward. That's going to get the sperm from the epididymis to the urethra. So that's how it's going to travel kind of all around to go to the urethra. Now, if you've heard the term vasectomy, that's actually cutting and ligating, meaning tying off the ductus deferens. So basically what happens is you cut it and you tie off this side and you tie off this side. So basically the males are still producing hormones, still producing sperm, but it's going to be reabsorbed after kind of a storage period. It can't be released through to the urethra. So that's going to be a very effective form of birth control. That's pretty easy, that you just kind of cut and tie off both sides, that the sperm just don't have a connected bridge. So it's kind of like the bridge is broken, so it can't go from one side to the other. The penis is the male copulatory organ, so this is going to be what introduces sperm into the vagina to go into through the cervix into the uterus. We consider external genitalia the things that are on the outside of the body. So the scrotum with the testes and the penis are on the external side. Once it goes internal, then it's going to be internal genitalia. So things like the seminal vesicles are going to be internal. There's different sections of the penis as well. There's the root, and then there's the shaft, and then at the tip, there's the glans penis. At the glans penis, sometimes there's what we call the prepuce, or also known as the foreskin, which is going to be skin that covers the glans. Not all men have, or males have, this prepuce or foreskin because of circumcision. So that is actually removal of the prepuce or the foreskin. And it happens about 60% of males in the US are circumcised, but in the other parts of the world, only 15% usually. And it's actually, studies have shown that 60% reduction if circumcision has occurred in HIV risk and other STIs. So reproductive infections, sexually transmitted infections. In the inside, so we have the root, which is going to be where it's kind of attached to the body, comes down, and then we have the shaft, and then the glands is at the end. On the inside, so when you cut the penis in half, we have spongy urethra. And so the urethra is coming through, exiting from the urinary bladder. So it's carrying either urine or sperm. And we have erectile tissue, so causing your erection. That's going to be connective tissue and smooth muscle with vascular spaces. So for erectile tissue, it's going to fill with blood. And that's what's going to lead to an erection. We have the corpus spongiosum, which is surrounding the urethra. So you have the urethra going down the center. And we're going to have the corpus spongiosum kind of surrounding the urethra. And it's going to kind of lead into the glands and the penis. And then we have corpora cavernosa. You might hear it also as corpus cavernosum. That's singular. Corpora cavernosa is plural. That's going to be kind of erectile tissue, erectile bodies that are going to be kind of outside the corpus spongiosum. I'll show you a better picture. Or you can see also in lab.